Hi everyone. I didn't realize that the technology I was using had a time limit on the length of the recording, but it's probably better that your recordings not be too long. So this is going to be part two. It'll be a lot shorter than the first one. Um, so let me bring back up the slides. Okay, so the last statistic we're going to be talking about is what's called the R statistic, and this is something that was introduced to you in the contact tracer class. So the R statistic is a statistic that's used to measure the rate of growth of an outbreak or a pandemic. So it's the number of people that one infected person will pass the virus on to on average. And the higher that number is, the faster the rate of growth of the number of cases will be. So if one person passes it on to two people and each of those two people pass it on to two more people, then it becomes four people. And if each of those four people pass it on to two more people, as you can see, the number of cases begin to increase very rapidly. So generally, if the R statistic is greater than 1, the number of cases increases exponentially. If it's lower than 1, then each case doesn't reproduce itself to even one other case. And so if the R statistic is less than 1, eventually the outbreak will just disappear. So we can look at examples like measles, which is a really, really, really contagious disease. And if you have measles in a population without any immunity to diseases, the R statistic is 15. That is, each case will infect 15 other people. So COVID-19 is fairly infectious, but compared to some other infectious diseases, not quite so. And so we'll see here in these maps that the R statistic changes over time as we put controls in place. And so looking at the R statistic is one way of measuring how good we're doing at controlling the pandemic. So this is the R statistic, a map of the R statistics by states back in March 22nd when the pandemic was in much poorer control. So as you can see, many, many states here are red or orange. So red or orange, the red or the R statistic is 2 or higher. So it's reproducing quite rapidly. But in this next slide, you'll see the R statistic in all of the country is much lower, and there's a few in the middle of the country here that have an R statistic a little bit higher, but around most of the country it's gotten under control, or what we termed flattening the curve. So this is another way we might choose to describe the distribution of cases or the distribution of rates. So this is looking at new cases over time. So you can see here, this is March, and this is over here where we are now. So again, you can see the exponential growth and then the decrease over time. And so this is often called an epidemic curve. So it shows the curve of the outbreak and the decrease. And this shows us that the controls that we put into place were actually working, and we've been able, at least in New York City, to keep the rates pretty low. Here's another picture of an epidemic curve, but this is the whole country. So this shows you that at the beginning, starting back at this is like January 1st, there was almost no cases. Then in March, the cases increased very rapidly, and we put into effect the various controls like social distancing, using masks, the shutdown, etc. And so here you can see we, as they described, flattened the curve. There were many, many fewer cases, and actually we started going down. So the R statistic was below 1 in many places. But what happened here? Well, it started going down, and we were a little too optimistic. And as we'll learn through various other modules, we opened up a lot of the controls. We opened up stores, businesses, etc. And the case rate climbed very rapidly again. So again, the R statistic started going down, but here it's clearly, 2 and going up, and now has slowly started coming down again, I think, as people realize that opening up so quickly was a mistake. So the last concept we're going to talk about is a concept called stratification. And this is related to the assignment you're going to be doing this week, where we talk about stratification and how it's used. So stratification means not looking at rates overall, but stratifying or dividing your rates across different kinds of populations. And so one example I've showed you in the maps is stratifying by state. So we can show rates stratified by individual states, and that allows us to make comparisons between the different states so that we can understand what's going on in one state versus another, because we know that each state had its own rules and policies. So the way you stratify your statistics should be based on your hypotheses and the public health actions you want to take. So in this case, we stratified by state because we knew that different states had different policies, and we want to be able to look to see if those differences in policies resulted in different kinds of rates. So here's an example of stratification in something that's completely different from COVID-19. This was stratification by what's called the community districts of New York City. So this is a map that was done by the New York City Health Department, and they were interested in stratifying by community districts, which are sub-communities within the larger boroughs. And they thought it would be important to show various health statistics stratified by these community districts so that policymakers could think about policies and programs that might be effective or look for risk factors in particular communities. So this is an example where they looked at obesity, and they were interested in stratifying by different parts of the city to see if the rates of obesity varied in different parts of the city so that they might target different programs to control obesity. So here's another map that they did, stratified in a similar way, but what they did in this case was look at the rates of consumption of sugary beverages like sodas that are have sugar added to them, or fruit juices that have sugar added to them. And so they looked at the rate of consumption of sugary drinks by the various districts of the city. And you can see here that the patterns are actually quite similar. So here's the pattern for obesity, and here's the pattern for sugary drink consumption. And obviously they did this kind of stratification because their hypothesis was that there was a relationship between drinking higher levels of sugary beverages and the rates of obesity. So when you make these comparisons, that might lead you and provide the evidence for controls over sugary drinks. So for instance, in New York City, there was an attempt to pass tax and extra sales tax on sugary drinks in order to discourage people from drinking them. So, so here's some examples of stratifying in relation to COVID-19. So there was concern originally that people thought the patterns of disease they had seen suggested that perhaps African Americans, Latino populations, and others were developing the disease at a higher rate. So what they did was develop mortality rates by different ethnic groups. So they stratified by ethnic groups and compared the mortality rates. So you can see here, this is the mortality rate per 100,000 for the white population. Here's the black population, Hispanic, Asian, American Indian, and Native Alaska Natives, and Pacific Islanders and Native Hawaiian. So you can see here that the Black or African American population, Hispanics, and the various Native populations had higher rates of mortality from COVID-19 compared to white populations and Asian populations. And so this is just the first steps that epidemiologists might look at, and then the following steps would be to try and do follow-up studies to understand what it is, what's going on in the African American, Hispanic communities that's causing them to have higher rates. And we'll be talking about this a lot. There's a whole module where we're talking about these disparities and the kinds of studies people have done. But the first step in trying to recognize that these disparities exist is to do stratification of your rates by different race and ethnic populations. And so the last thing is a different kind of stratification, similar to what you saw with obesity and sugary beverages. What they did was to stratify the rate of cases. This isn't deaths, but this is the rate, the total rate of COVID-19 cases by 100,000 population for the different community districts. And the darker the color, the higher the rates in those communities. And so you can see that there's definitely certain communities that have higher rates. Interestingly, those are overlap with some of the communities that also had higher rates of obesity. And so we see here that not only is it certain race and ethnic populations, but also certain parts of the community, certain communities within New York City. So this becomes evidence that the health department and researchers would do to try and dig down to find out what's going on in those populations so that we can develop better prevention techniques that are targeted at those populations that are being most affected. And so you'll have a reflection paper this week where you're going to be thinking about stratification, what kinds of stratification can be done, whether it's by race, ethnicity, or age, or geography, gender, and what that tells us and what that might mean about various kinds of prevention approaches. So that'll be your assignment for your reflection paper. It's explained in detail on the Blackboard page and describes what you'll be writing about.